Good morning. Shall we make a start to today? We've got a really full day, and I'm very pleased that we've also got a very full room here. We could have actually filled today probably 2 or 3 times over, so it shows what enthusiasm and interest there is on this subject of adverse childhood experiences. I'm Linda de Caestecker, and I'm the Director of Public Health here in NHS Greater Glasgow and Clyde. But I also have the privilege of chairing what we call the ACES Hub here in Scotland. It's probably quite a grand name compared to what you'll hear about is happening in Wales, where we've learnt a lot of their developments around ACEs. But what we're trying to do is raise awareness around adverse childhood experiences across all of Scotland, all the different agencies, professionals across society in Scotland. And importantly, to think, how might we prevent ACEs? And certainly, how might we mitigate the effect of adverse childhood experiences? So this is an important event bringing together Health Scotland and Education Scotland. And I'm not aware, although we all meet together around various tables and community planning, I'm not aware that there's been many events just bringing together public health and education to talk about such an important subject. So it's an important event, and I hope we will work together in following up the actions that maybe we think about during today. On Monday, Harry and I are actually meeting with John Swinney and a number of other members of the Cabinet around ACEs and what's Scotland's response to ACEs. So again, I hope that what comes out of your discussions and the presentations, we can take into that wider discussion around how do we respond to ACEs in Scotland. But I also hope that you will learn things that you can take into your local situation and your local practice, and we can learn from each other during our workshops, because you will have many good examples from your own practice, from your own workplaces, where you are responding to the needs of children who've suffered difficult circumstances, and how you best do that, and how you do it at a school level, and how we do it at a community level. So, what we're trying to do in the event today is to gain that common understanding of what do we all mean by adverse childhood experiences, and think about the impact that has on health, on learning, on children's behaviour, to share examples of how in educational settings we try and address that, and then also to bring us together to think about what are some of the joint bits of work we could do in the future. So this is the start of a process and not the end of it. We've got some great speakers here today, and that's why it was so nice to be asked to chair this, because it's a really good way that I can say, I need this day free to be able to come along to this, and I'm really looking forward to hearing the speakers. But also when I looked at the workshop titles, I thought I'd like to go to all of these. They all look so interesting, so I think you'll have a very stimulating day.